What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central still processor? Guys, we are going back to basics and we're talking elevators and dissectors. All right. Many instrumentations kind of they flop around with both words. It's either an elevator or a dissector, right? But two different functions. But it can happen with the same instrument. So take this one here for example. Or the most common, this isn't the name for this one, but the most common elevator you can think of is a periosteal elevator, right? So what does it do? Okay, the instruments are designed to elevate or to dissect a tissue off of another. Okay, so an elevator, imagine two organs next to you. An elevator is used to elevate one piece of tissue over the other. Okay, whether it's a bone or a muscle, it's just the elevator so that you can get under there. It's not meant to hold in place because it's not a retractor, but it's meant to kind of move it out of the way, right? And then stay there. For a dissector, think about the periosteal elevator, okay, or dissector. What is the periosteal? The periosteal is the actual layer surrounding the bone. What does that look like to you? If you've never been in surgery, I didn't even know bones had skin on it or a layer, right? Well, think about if you're a cook or watch a video or a barbecue video. That rack of ribs, when you turn it over to the bone side, when they tell you to peel back the silver skin, that's the periosteal that you're pulling off. It's a very tough layer that surrounds the bone. So how would a surgeon do that? Is he would make a slit in the periosteal and then use a dissector or elevator to get under that periosteal. You don't want to destroy it or damage it because it's a very nutrient and protected part of the bone, but he wants to dissect it and remove it from the layer of that bone, flap it back or move it off to the side, retract it off to the side so that he can perform surgery on the bone tissue itself and not the periosteal. All right, so that's what that does. The same thing with skin. If you think about making a pocket, think about turkeys. Okay, that's my famous thing that I do is when I roast a turkey is I dissect or undermine the skin. I don't remove the skin all the way, but I make a pocket under there. I'm actually dissecting the skin off the muscle so I can create a pocket and put some butter in there, so forth and so forth. Now, I don't use surgical tools to do that, but I use my finger or I use a knife to get under there. All right, that's what elevators and dissectors do. But we're in prep and pack, so what are we doing with our surgical instruments? We're not ready to go, take the skin off of a rack of ribs or of a turkey. These are going to be used on patients, so we have to inspect for cleanliness, any damages, and check the function of it, right? Most elevators are one piece. Okay, this actually happens to be a knife handle modified with a dissector at the end. It's a cottle knife with a cottle elevator or a cottle dissector at the end. But what are we inspecting? We're looking for pitting. We're looking for any soils. If it has any removable parts, we want to remove them and inspect them well. So here comes our handy dandy lighted magnification, and we're looking for any soils. Okay, this happens to have a spring action or blade holding jaw that moves. So you're looking for any cracks, any debris right in that gap. Okay, the threads. Okay, there is a hollow area here. You want to look in there to make sure that there's no debris in there. If you have a borescope, it'd be nice to go down there and look to see if there's any discolorization, rusting, or baked on or packed up soil in there. That'd be a good opportunity to do that. Okay, you don't want the parts lost, so you want to loosely keep that on there. Check the IFUs to see if you have to sterilize it removed, or you can just lightly place it back in there. Okay, for larger elevators, again, that are one piece, there's no soldering or any welding, so you're looking for damages in the instruments, heavy scratching, heavy dents around the elevator itself, right? Whether it's round, oval, curved, straight, you want to make sure that that is a very smooth edge. And most elevators are sharp, guys. It has a sharp edge on it. Okay, it's not sharp like a knife where it's gonna cut easily, but it is sharp enough that it can cut you. Okay, it's used to dissect, so it's gonna actually get under a skin or lift up that periosteum or that tough skin off the bone. So it has to be pretty sharp. Okay, so you want to make sure that there's no dings in it, no kind of bending or excessive damage around that smooth edge. Okay, same thing with this one. You want to make sure it's nice and smoothed out. But if you feel it, it's pretty sharp. All right, so you want to get that magnifier on there and look at it really good. Make sure it's sharp. And would I do a sharpness test on this? I actually would. And here's our handy dial. Thank you for pointing this out. It is such a unutilized testing tool in our field. But again, I want to show you guys these are sold singularly or in kits. Check with your repair company to see if you can get them. Please do not hold this rod as such. Okay, you want to hold it flat and put pressure on one end, and then take the sharp end of the elevator and you're going to try and bite into that rod. You should be able to remove a small amount of this plastic dowel rod. But when you do that, guys, please, 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 please make sure you recover that material, right? Okay, you don't want to have that end up in a container. So make sure that you wipe that off. Okay, all your elevators, again, away from the body, never towards. You're going to this is the rounded edge. You want the rounded edge pointing up towards you and the sharp end flat, and you would bite into a rod and make sure that that is nice and sharp and that is catching, because again, for some surgeries, it's dependent of that sharp edge, right? It's not excessively sharp, but it's sharp enough that it does its job correctly of dissecting and undermining the tissue. So you soil tested it, you did your function test, right? So I made sure it was like a nice and sharp right there. Again, when you package these, with some of them, depending on the policy in your hospital, you may need to put a tip protector on there so it doesn't flay around in there. If you're using the sterilization bags, you should put them in the sterilization bags. And again, protect the end user, because again, some of these are pretty sharp. You don't want the end user getting cut. So tip protectors are good. If you're placing these in sets, there's usually more than one of them. Keep them together. But that's all I have for you guys. Hopefully you found this video informative. If I missed anything, please comment down below. As always, guys, stay true to yourselves. Keep it 100. Continue educating yourself. And until next time, peace.